Good afternoon, and thank you for joining us. My name is Dr. Majda Behani. I'm a board certified pediatrician at the AdventHealth for Children in Orlando. AdventHealth for Children is proud to provide a network of pediatricians throughout the Central Florida. Okay, I'm here alone right now in my office, so I will remove my mask so you guys can see me. We know that it's pretty overwhelming and confusing for the new moms to find the right pediatrician. So I'm here today to maybe help with some guidance for you guys to find the perfect match for your little one and for your family. Best time basically to look for the pediatrician is sometimes asking around, so around 24 weeks or 28 weeks when you are pregnant. It's a good idea to start to ask your family members, your coworkers, your neighbors, to kind of give you an idea who they really like and how their office visits are and how comfortable do they feel, by the way, with their pediatrician. Um, Most of the time, okay, before the baby leaves the hospital, they're gonna be already have somebody assigned, okay? So that will never be a problem, okay? On the discharge from the baby's hospital, on the bottom, there's gonna be a pediatrician's address and their name. And if mommy doesn't pick somebody, the hospital will typically assign the pediatrician that's under the insurance or it's in the neighborhood for something, so they will know before they leave. Because once the baby is discharged from the hospital, typically they will follow up in 1 to 2 days, depends on how the baby is doing. With the If you have questions, by the way, during my presentation, you can go on a chat and ask a question, and I'll see if I can maybe answer some of those questions for you guys. Okay. Typically typically in my office, I can let you guys know. In my office, typically when the babies are born, we also round in the hospitals. So babies who are newborn, sometimes we round on the baby, and before the baby is leaving the home, we will let them know if they want to, be one part of our pediatric office, or if they want somebody else, that's also okay. We also want to let you know if you currently have a child and you have a newborn or are gonna have a newborn and you're not happy with your pediatrician, it's okay to look for somebody else. When you're looking for a pediatrician, it's always a good idea to call the office if you can. And a lot of offices, including our office, will actually have you schedule sometimes in person to come and see the pediatrician. Like I have quite a few mummies, and whole family actually. Or sometimes they will do the virtual. Sometimes we'll do the group. So if there's quite a few family, actually we can do the virtual group so expecting families can know what to expect, how the office, what we typically do. It's always good idea to ask the office if they are able, by the way, to schedule sick appointments, how hard it is to schedule a sick appointment. If they have any questions, if they can call the office, even after hours, to see if they can be answered. And we have a 24-hour, one of our providers, one of us, including myself, can on call and will answer the questions. We take turns, so it's not always the same providers. So we'll be able to answer the questions at any time of the day, basically. I also want to let you guys know that in the hospital, so AdventHealth Children's Hospital also has, by the way, they're called health navigators, that when moms are pregnant, they will actually help families navigate their questions, let them know, by the way, if they have any clinical questions, and will kind of help them navigate, know where to look if they need anything. just want to let you guys know that they will make sure the pediatric office takes you guys' insurance, and most of the offices will take the insurance, but always double check because sometimes their panel is full, and some of them are willing, by the way, to take both insurance, means private and Medicaid, versus some of them only do the private. Okay, so so right now, my office is in the public office. It's a new office. It's a beautiful, brand new office. My office is getting busier, but we always welcome in new patients, and we see the babies from the newborn all the way actually till 21 years of age. So when you're calling the pediatric office, just make sure that you guys are asking if there's some offices will just take the newborns, and some of them will only take, by the way, established. So it's always good to know, okay? I just also want to let you guys know that our office, it's called Twilight, which is once, for example, my office closes, there's a twilight hour. So after 5, there's a twilight hours till 8, that we see sick patients. It's not in my office. It's not a public office because it's a newer office, so we don't have yet that. But we have a sister office, which is our Orange City and our Lake Mary. They're the ones that will typically see the after hours and on the weekends. So with AdventHealth, we love because it's a huge network. So we have anything you guys want. We have any specialists. We're able to get in touch with the specialist. We're able to talk with the specialist. We are able to get the kids next day if we need to. We also able to admit the patient. So if somebody is sick, I can call the emergency room and I say, okay, I need this kid admitted. I'm able to admit the kid, and I'm getting all the feedback. Same goes with the specialist, okay? I am able to communicate with the specialist. I will let them, we can discuss what's the next step, why I want a specialist to see the patient. Like if the baby has a murmur, I could call and say, no, this is a newborn, or I need this baby seen as soon as possible. So they're pretty good. They're very good. They see them right away, and they give us feedback. They let us know if anything else has to be done. We also very good, by the way, at least I know I am, about following, by the way, the patient. So if there's something concerning and I want to make sure that the things are being done, that the patient went somewhere I want them to go, like the specialist. Or if they didn't do the blood work, we're pretty good about making sure that the patient does the blood work, especially with something concerning, okay? So to find a pediatrician, okay, lots of families, and I did touch up a little bit about it, okay? So most mommies, it's a good idea to start the minute when you start getting pregnant. But really to get serious into it is around 24, 28 weeks, okay? Then you want to really start to have, so that way the baby comes sometimes earlier, you're not in a panic, okay? So start asking around, okay? Find the office that is close to you guys. Find the office that is not very busy, it's super busy, that you can be able to talk to the pediatrician, okay? I get a lot of, by the way, phone calls, but also with AdventHealth, families can send me through the portal a question, updating me, or if they need something to talk to, they will put in the portal, can I talk to you because so-and-so is not, after so-and-so done, it's still not doing what we were expecting, so I can call and kind of get a little bit more. So that's good about AdventHealth, okay? Other thing, by the way, so before I go in the next section, just want to ask if you guys have any questions. If you have any questions, put the question. So when the babies come to the office, okay, so once the baby is born, depends how the baby is doing, okay? So if the baby looks a little bit more jaundiced and the hospital checks the baby jaundice, the yellow pigment, If the baby's level is not too high, then the baby is good to go the next day. If it's or the following day, depend on what the level is or the weight, because the babies can dip a little bit, can lose a little bit of weight in the hospital. So depends on how baby's doing, how is baby latching, is the baby feeding okay. So if there is not too high of a drop in the weight and the baby doesn't look too yellow, baby's good to go the next day or day after. Once the baby comes to our office, we'll check the baby's weight to make sure that and see how the baby's doing, how the feeding, how is baby latching, how many pees and poos, which are very, very important. And we check the bilirubin again. Okay. So most babies and in the hospital, by the way, babies will be, by the way, and they have a lactation team that they will work with mommy to make sure that the baby can latch on. All mommies get that, by the way, and some need a little more help. They will also get it a little bit more in the hospital when they by the way come to our office. We also have a referral if you need to. Our office actually we have a lactation team that can actually help. Not in my office, but my sister office, which is a Lake Mary, they have a lactation team that can work. Okay. Same goes for the circumcision, by the way. Some babies are circumcised in the hospital. Some babies, when they discharged from the hospital, they will be circumcised in our office. Okay, so that's another thing. But once the baby is discharged, after a day or two, then and baby's doing good, we saw the baby. Then as the baby, if the baby looks good, yellow is not yellow, the weight starting to gain a little weight, then the baby usually be seen around 7 days of life, and just to make sure the baby weight is doing good, that there's no issues. And then we see the baby at 14 days, then at 1 month, 2 months, when that's the shots. So 2 months, 4 months, and 6 months, those are the shots months, okay? And then we see the baby at 9 months. Typically, we don't have a shot that visit unless it's a flu season. Then we give them a shot. Then we see the baby at 1 year, 15 months, 18 months, and 2 years, okay? So with the babies, by the way, every time the baby comes, we always check the baby from head to toe. So we look for, when the newborns are born, we look at how the baby's head looks like, soft spot. We look at the baby's color. We look at the baby eye reflexes. We look at the baby's mouth. Is the baby having trouble latching on? We look at babies. We listen to baby's heart and lungs. We also check by the baby's tummy. We look at the baby's umbilical cord. So, and then we let the families know what to expect, what's normal, what we to watch for, okay, for circumcision. So when the babies are circumcised, okay, most babies for a day or two, they will feed, they will do everything else. They will just a little bit more, they can kick a little bit more with their leg. They can be a little bit more, just cry a little bit, but most babies are fine. Most babies are fine. They will feed. I always tell families feed more often, because when the baby sucks on a bottle or breastfeeds, actually numbs their pain, so makes the pain, by the way, better. So they're able to pee, they're able to do pretty much, be whole, swaddled. All of that will, by the way, help. Mostly want to watch for any bleeding. That's the mostly, and I always advise. After circumcision, we talk a lot. I tell families what to watch for. Mostly it's just bleeding, making sure that they're applying that cream, the topical antibiotic that we usually send them home. And we let them know if there's any question to call us. But we tell them just feed, because that helps the baby to baby to feel better. All right. And so vaccine schedule. Okay, so typically most of the babies will be vaccinated in the hospital. Okay, so that's the first shot is a hepatitis B shot. That's the shot that most babies before they leave. Some families don't want it, so we give them on our next visit or visit after that. That's the first, hepatitis B. After that, is there 2 months? 2 months is the next set of shots. So 2 months, 4 months, 6 months is the shot months. Okay, then we have 1 year shots. Then we have 50-month shots, 80 months, and then 2 years is the last shot, and they're done. So with the babies, so I always tell the families, till the baby gets those two month shots, okay, because the baby's not vaccinated, you have to really watch. So any fevers, okay, or anybody who's sick or anything else, okay, we worry. So typically by 2 months, they don't want really baby traveling anywhere. They don't, no daycare, no ear piercing, till the baby gets those 2 month shots. Okay, once the baby gets those 2 month shots, you celebrate, you're all good to go. All right, you can spend time outside, you can see more family. The baby's considered protected. Okay. So what question to ask the pediatrician? So when you are looking for the pediatrician, okay, so when you call the office, by the way, you can, by the way, ask them, by the way, what's their policy regarding the new patients, okay? You want to know, by the way, how hard it is to get the appointment. If you have a sick child, how can you get the same day appointment? Okay. You also wanted to know, by the way, if you can call after hours, if you're going to be charged for calling after hours. You also wanted to know, by the way, if the family has any questions, how can you communicate with your medical team, and also you wanted to know, by the way, about their vaccine schedule. You wanted to know, by the way, about their, by the way, in general, by the way, how their how most of the time it's how busy the office is, because if they're busier, then sometimes it's harder, by the way, for the team to get in touch. And I'll always make sure that, by the way, the insurance is, by the way, so if they're taking new patients, and what age of are they going from newborn till what age, okay? Um, So at 9 months, I see somebody's so what's good to ask at 9 month visit. So at 9 month visit, so with my baby, so 9 month visits, by the way, typically we go into, by the way, what's baby's milestones. I love to do any visit, we go into milestone, because milestones tells us a lot about how the baby's doing. And by the way, we always do heights and weights, and always print them, and I show them families how's the heights and weights, and so they know how is their baby doing compared to the rest of the babies. Okay. But at 9 months, we start to go over, by the way, is the baby starting to by stand? Is the baby, by the way, at 9 months, by the way, using we call it the pictographs, so they're able to pick up little things. So how the feedings, because at 9 months, we want to start some table food. So 9 month old baby should start to have table foods. So we go into that. We also go, by the way, and if the baby starting to use any sounds, okay, if they're using any words, peekaboos, and if they start to wave, that kind of stuff. So about the circumcisions, okay, I see somebody's asking me. So best time, honestly, if it's, I have 4 kids, my 2 boys, they were vaccinated in a hospital, and I believe it's sometimes better to do it in a hospital, only because the babies are sleepy and more sedated. They're like really like in almost like a trance zone. They're sleepier, they're quieter, they're almost, it's easy to get it, okay? So they will feel less discomfort. Once the babies get older, so the older the days, the more the days pass, the baby's more alert, maybe cries, baby. So, so, so I always say, if you can't get them in the circumcision in the hospital, if not, then we're gonna do it, and we typically want to do it before they're 14 days. We can do it up to a month, but when the babies get older, it gets a little bit more discomfort, and there are if they're putting too much weight, so there's by the way cutoff. If they're by the way 10 pounds, then they're too big for our instruments. If they're by the way older than 1 month, most of the offices, by the way, they will send them, by the way, then to urology, because they're just getting too old. So about the COVID, so our office, and I know lots of offices, everybody's, by the way, super careful. Okay, so in our office, by the way, we're doing it's called a virtual. So when the family calls and they want an appointment with well child or a sick visit, then we're gonna be send the link. Okay, it's called a check check-in link. Okay, when their appointment time is coming, they got the link and they do the check-in virtually. They sit in the car till the appointment time. Once the appointment comes close to, they're still sitting in the car. My nurse will call them, let them know that there's their appointment and that the room is available, and they can come in. So once they're coming into the office, they don't sit anywhere. They check with the temperature. They're given mask. If they don't have a mask, both the mommies and the child who is 2 and above. Okay. But even some younger kids, if they cannot, we always try. Everybody else is, by the way, wearing masks, and we providers are all wearing, by the way, including my nurses, shields. So there's no waiting, by the way. There's no waiting. There's no I'm waiting, by the way. Waiting room is closed. Okay, there's nobody there. So basically, from the car, you go to the hallway, and we by the way do one family at a time. So nobody's running into nobody. No family running into nobody. They get straight into the office, into the room, and they sit in the room. And our rooms are sterilized. Okay, my equipment, all my stethoscopes, all my otoscopes and ophthalmoscopes, they're all sterilized. Before I see any patients, we wear gloves, we wear shield, we have all shields, a mask. I use double mask and the shield. So we're doing a lot of precaution, a lot of precaution. Okay, and we have baby hour that's different from any other hour. So we have baby hour is only when the baby comes, and that's only in the afternoon. And then so we have sick appointments which are separate from the baby hours. Okay, so that way no sick kid is running to baby hours. Okay, so circumcisions. Okay, so as a medical provider, okay, so circumcision. Okay, so now American Academy of Pediatrics, by the way, they are it's a family decision, but I have 2 boys. Both of my boys were circumcised. When the baby gets circumcised, the skin that's removed, it's actually helps so the urine, the dirt and stuff doesn't collect around the entrance or over the head of the penis, because that stuff increases more chance of the urinary tract infections. So kids who were not circumcised and who start to have recurrent urinary tract infections, they actually the urologist will actually recommend them to be circumcised. Okay, so being circumcised, it just improves, it lessens the chance of infection, and also lessens your chance down the line, like penile cancers. Okay, and we call it like balanitis, like inflammation of the foreskin. And so there are a lot of benefits. Okay, but it's still the family's decision. Okay, so we approach the end of my visit with you guys. Okay, if you have any questions, I'm very thankful, by the way, for giving me this opportunity so I can talk to the mommies and the future babies. If you have any questions, you're welcome free to post down on the chat stage any questions. Okay, all right, and good luck, everybody. It's gonna be okay. Alrighty. Please visit our AdventHealth booth. We have a lot of by the way stuff for you guys there, and hope to see you all. Alrighty. All right. Bye, you guys.